Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. OAEs. So it is nothing but the Otoacoustic emissions. So this is nothing but a test. So what kind of test is it? It is an objective test. It is objective test that records the low latency sounds. So it is used to record the low latency sound. So it records the low latency sound, and this is produced by the outer hair cells. So this is produced by the outer hair. So by the outer hair cells of the normal cochlea. So outer hair cells of the normal cochlea. Next, there are two varieties of this otoacoustic emissions. So there are two types. So the first type being, it is a spontaneous type, and the second one being evoked type. So in spontaneous type, it is generated spontaneously. So as the name suggests, it is spontaneous and it is present in 50% of the normal individuals. So 50% of the normal individuals. Next will be the evoked variety. So here in evoked variety, evoked types, it is also called the Kemp echos. So it is also known as the Kemp echos. So Kemp echos or the cochlear echos. So it's the Kemp echos or the cochlear echos. So they are generated in response to the sound stimulus. So they are generated in response to the sound stimulus. So this is due to the sound stimulus, and also it is found in all individuals. Previously, the spontaneous type was in 50% individuals. Now the evoked is present in all individuals with the normal hearing. The two subtypes are the transient evoked and the distorted product. So those two subtypes, it includes a transient. So it is the transient evoked, and the next variety will be the distortion product. It is a distortion product. Now what are the applications of the OAEs? So going by the application, it includes the screening test. So there is a screen. So screening test is for the neonates, infants and the small children. So it is for the neonates, it's for the infants as well as the small children. So they are the screening test for them, and it screens for the deafness due to the inner ear causes. So they encounter deafness due to the inner ear causes. And second one is application is it helps to differentiate the cochlear and the retrocochlear hearing loss. So to difference, and this will be between the cochlea. So this will be the cochlear versus the retrocochlear hearing loss. So cochlear versus the retrocochlear hearing loss. So the normal OAE. So what does the normal OAE indicate? So looking at the normal variety of the OAE, it indicates a normal cochlea. So there is a normal cochlea, and hence it indicates a normal cochlea, and hence the retrocochlear pathology in a patient with a sensorineural hearing loss. So in terms of the retrocochlear, so the retrocochlear pathology in terms of the in patient with a sensorineural deafness. The next application will be the early detection of the noise-induced hearing loss. So there is early detection, and the early detection takes place, early detection of the noise. So early detection of the noise-induced hearing loss. So noise-induced hearing loss. So since it is generated by the outer hair cells that are prone to the damage by the noise trauma. So this is due to the damage of the outer hair cells. So they are very much prone to this. To learn and grow daily like this, please do subscribe.